digestive system is made up of the gastrointestinal tract, also called the GI tract or digestive tract, and the liver, pancreas, and gallbladder. The GI tract is a series of hollow organs joined in a long twisting tube from the mouth to the anus. How does the digestive system work? It may seem like digestion only happens in your stomach, but it's a long process that involves many organs. Together, they form the digestive tract. Digestion begins in your mouth, where saliva starts to break down food when you chew. When you swallow, your chewed foods moves to your esophagus, a tube that connects your throat to your stomach. Muscles in the esophagus push the food down to a valve to the bottom of your esophagus, which opens to let food into the stomach. Your stomach breaks down food using stomach acids. Then the food moves into the small intestine. There, digestive juices from several organs, like your pancreas and gallbladder, break down the food more, and nutrients are absorbed. What's left goes through your large intestine, or the colon. The large intestine absorbs water. The waste then moves out of your body through the rectum and anus. Digestive problems can happen anywhere along the way. Diarrhea and other digestive problems are no fun, especially for people who suffer from them often. Such problems can be a result of bacteria in food, infection, stress, certain medications, or chronic medical conditions such as colitis, Crohn's disease, IBS, and etc. But no matter what the cause is, anyone who has frequent digestive problems faces daily challenges and potential embarrassment. Do you schedule your activities around your bathroom breaks? Do you turn down invitations and avoid activities in public because you fear having an accident? If that sounds like you, rest assured you're not alone. Because I personally often had stomach aches from time to time. Last year I got hospitalized because of this. I suffered, and that made me lose weight rapidly. From 55 kilograms to 45 kilograms. It was a clear 10 kilograms of losing weight unintentionally. It was an unexpected event. At first, I thought it was a normal LBM. I often go to the bathroom and keeps on pooping. Then one night, after days of having a normal stomach ache, and I didn't pay attention much because I thought it was normal. It's past in the evening that night. I felt I went to poop, and then I did go to the comfort room. It was very painful, and that I can't seem to breathe well. The process is very painful that when I'm done, I can't stand up well and keeps on rubbing my stomach and utter painful words. And I kept on praying and praying because I thought I'm going to die. Luckily, my father came out for that night for his daily, night routine, and saw me struggling in the corner. Then immediately asked me if I can handle it, but I can barely talk because of the pain. At first, they're trying their best to make me feel better. They apply different ways to ease the pain I felt because we are scared and going to the hospital because of the pandemic. They made me drink several medicine, apply some ointment, but still I feel weak and hurt. That it feels like anytime I will black out and collapse. When I can't respond to their questions, they immediately took me to our experts and they injected me pain reliever. And also they put dextrose on me because I am dehydrated that night. But still I didn't felt okay the next morning, and my family took the risk to bring me to the hospital nearby and found out that I had acute gastrointestinal amoebiasis and also lack of potassium in the body. Did you know that gastrointestinal amoebiasis is an infection of the large intestine caused by microscopic one-celled parasites commonly known as amoebas or Entamoeba histolytica? Because these parasites live in the large intestine, in the colon. They travel in the feces of the infected people and can contaminate water supplies and places where sanitation is poor. The parasite can contaminate fruits and vegetables grown in areas where human feces are used as fertilizer. They can be transferred on the dirty hands of infected people who don't wash their hands often or correctly. People can get this parasite by eating or drinking something that's contaminated with it. Once amoebas enter our mouth, they travel through the digestive system and settle in the large intestine, or in the colon. Harmless strains of the parasite or Entamoeba dispar live there without causing damage. Entamoeba histolytica can live in the intestine without causing symptoms, but it also can cause severe disease. These amoebas may invade the wall of the intestine, leading to amoebic dysentery, an illness that causes intestinal ulcers, bleeding, increased mucus production, and diarrhea. These amoebas also may pass into the bloodstream and travel to our liver or infrequently to our brain, where they form pockets of infection or abscesses. For your information, I also had ulcer before having gastrointestinal amoebiasis. From time to time, I am having stomach aches every time I am delayed in my eating habit time. Peptic ulcers are open sores that develop on the inside lining of your stomach and the upper portion of your small intestine. The most common symptom of a peptic ulcer is stomach pain. Peptic ulcers include gastric ulcers that occur on the inside of the stomach, duodenal ulcers that occur on the inside of the upper portion of your small intestine, or duodenum. The most common causes of peptic ulcers are infection with the bacterium Helicobacter pylori and long-term use of nonsteroidal anti-inflammatory drugs such as ibuprofen and naproxen sodium. Stress and spicy foods do not cause peptic ulcers. However, they can make your symptoms worse, because I have felt that. The most common peptic ulcer symptom is burning stomach pain. It's really painful. Stomach acid makes the pain worse, as does having an empty stomach. The pain can often be relieved by eating certain foods that buffer stomach acid, or by taking an acid-reducing medication, but then it may come back eventually. The pain may be worse between meals and at night. Peptic ulcers occur when acid in the digestive tract eats away at the inner surface of the stomach or small intestine. The acid can create a painful open sore that may bleed. Your digestive tract is coated with a mucus layer that normally protects against acid. But if the amount of acid is increased, or the amount of the mucus is decreased, you could develop an ulcer. Yes, you could develop an ulcer. Peptic ulcers can affect anywhere in the digestive system. Symptoms include stomach pain, something feeling like indigestion and nausea. Causes include bacteria and certain types of medication. Treatments include proton pump inhibitors and antibiotics. That is why we have to understand that we need to take care of our digestive system, because it entirely affects our body activity. According to James Altucher, life is better when your sinuses are clean, when your arteries are clean, and when your digestive tract is clean.